I've never been there again. Outside of the box.
Alright, so welcome to my channel, and if you are here for the first time, thank you very much for joining me. I really do appreciate it, and I do hope you stick around, so don't forget to click the subscribe button. Also, since this is my first medical video, it's supposed to at least teach one person one thing. That's the aim. So if you learn anything from this video, don't forget to comment down below and tell me what did you learn, or so if you have any questions, because I'll not be able to cover everything in this video since I'm trying to keep it short, don't forget, you can just ask below, okay? I'll try as best as possible to answer based on what I know and based on my experience with it. And don't forget to click a like. It's just one click, guys. Just a click. Encouragement sweeten labor. That's what people always say. So yeah, let's get straight to it. Alright, so a tongue tie. I was born with it, and basically what it is the tip of your tongue here attached to the floor of your mouth, like down here, right? And inside, right? So basically when you are born, right, this is there, you're born with it, right? However, what is supposed to happen is that before you're born, that piece of tissue that attaches from the tip of your tongue to the floor of your mouth is supposed to go away. However, if it doesn't, which most people don't know the cause, most people say it's idiopathic, which means it doesn't have a reason, or most people associate with genetical factors, which means it passed from your ancestors way back then, whatever the case is. Right? So basically that's it. That's really it. Just the tip of your tongue being attached to the base of your mouth. Right? So it does have a few complications. When your baby is born, if you're
Female, well, okay.
Females or females will have problem breastfeeding the child. You realize that the child doesn't breastfeed properly. Also, you can realize that when it's time for the child to talk, the child has speech problems. And they can also have problems swallowing, eating, stuff like that, basically. Also, they can have hygiene problems, basically, where they have problems sweeping the food. You know, your tongue is supposed to help with all of the whole process of sweeping the food back and stuff. They will have that problem. Why? Because the tongue is technically a bit shorter, and also one thing you use to identify this is that the tip of your tongue, like your tongue cannot stretch forward. So like mine, when I was born, well, until this day, even after doing my surgery, my tongue cannot fully extend. So you here, that's the furthest you can go, like there. So that's one way to recognize that your child has a tongue tie, or whoever it is. Another way is that, as I said, they have speech problems, speech difficulties. They have problem eating, breastfeeding, swallowing, and so forth. I'll tell you my personal experience with it. It's not really listed when I went to do the research on this tongue tie, but it's something from personal experience. Alright, so when to see a doctor. I'm going to tell you all the basic details you need to know before I share my experience. When to see a doctor. Your baby have problem breastfeeding. Obviously, you need to see a doctor with that. If the child has speech problem, if you're older, like this normally happens with your older children, like problem speaking, problem eating, like maybe when they're 2 years old or 1+, whereas that they're supposed to start speaking, but they really have a problem with that. What are the causes? As I said before, most of them are idiopathic, which means that they don't know what happened. It's just that it never separated. They can't tell why. It never, like that little piece of tissue never disappeared or left. They can't tell why, but sometimes they do associate it with gene problems, like maybe somebody in your family had it and now it's passed down to you through your genes, whatever the case is. I don't know, because I was born in a family with my mom never had it, my dad never had it, my siblings never had it. I was the first one and I'm the last child, so I don't know where mine, like the cause of mine, but you know, it's basically idiopathic. All right, so they do have some few complications that is associated with this tongue tie. Most of the time, persons have problem pronouncing certain letters like T, D, Z, S, T, H, R, and L. So they can have other problems like pronouncing other letters, but these are the major letters that they do have a problem pronouncing. Also, it can have poor hygiene, which means that difficulty sweeping the food debris to the back of, like, basically, sometimes you eat and you just like clean your mouth with your tongue. Sometimes they will have a problem doing this. This can contribute to your tooth decay, or basically inflammation of your gum and stuff like that. It can also lead to the formation of a gap or space, which I had. Mine was very big. Yeah, I'll show you that later. And lastly, one of the things I saw when I did this research, it was like a bit, not really funny, but it was quite interesting. Now, you have problem licking your ice cream. I mean, it's not a big deal, but yeah. And you have problem licking your lips. So if your tongue is like basically can't pass here, which is the last two bottom teeth, well, the middle two bottom teeth here, then you have problem like licking your lips. Yeah. And you have, for all of the, you have a problem kissing, right? So yeah, and you also have problems playing wind instruments. You recognize that your tongue has a heart shape. So when I stretch my tongue, at the end it kind of shaped like a heart, and that is because the tip is attached, right? So basically those are the major things you'll see with a tongue tie. Apart from your speech problems, swallowing problems, breastfeeding problems, kissing, playing wind instruments, and licking your ice cream. Yeah, basically that is basically it. Now, because of time, I'm going to quickly wrap this up. So I'm going to tell you my experience with the tongue tie, what I did, my surgery, and my braces. So I was born in a house where, as I said before, nobody really had it. So it never seemed like a problem to me. So when I went to the dentist, though, when I was like in high school and I started going to the dentist by myself, I realized that all my teeth were fine except right here where my gap is. There used to be some small yellow things attached. They call it tartar or something like that. And basically what happens is that every time I would go to the dentist, that is the only problem I have. So when they're cleaning my teeth, they mostly focus on here. Now, going to the dentist at that time, I did not know that this was cause of my tongue tie. Actually, I didn't know that the gap was because of my tongue tie. So first, I had a tongue tie, which I was born with. Then it caused the gap here. Then that gave me the yellow things that were here. That wasn't cute. So I always went to the dentist to just take it off, clean it off. I don't want it. So when I came to China, actually, when I was growing up in Jamaica, I mostly spoke patois. So apart from school, where you're probably forced to speak English, and work where you have to speak English, especially I worked at a call center where I had to answer the phone, and so you have to speak English. So apart from that, it was basically patois. So I didn't recognize that I do have problems pronouncing certain words. And when I came to China, when I went to Chinese class, I do realize that I did have a problem pronouncing like H in Hui, like H-U-I. I used to say K-U-I, right? So like Hui instead of Hui. All right, so basically that's one of the major things I had a problem with pronouncing certain words and the little yellow things that would be on my teeth, like right between the gap. I really did like my gap. I still do like it. However, it will be gone soon to help me like keep away those yellow stuff. All right, so most people said to me, why would you want to close it? I never really explained because it was a personal thing for me, and I really just never wanted to and a lot of people asked me, so I was just like too tired to answer. So basically, I didn't like the yellow thing on my teeth. I hated it so much. It wasn't cute at all, as I said. And I do realize that I had problems speaking pronouncing certain words and stuff like that. So I decided last December to go see my dentist here in China. And he said to me, like, while he was cleaning my teeth, because I still do clean my teeth every 6 months, which is something you should do. It's like, it's recommended that at least every 6 months you should visit your dentist, right? So when I went to my dentist, he said to me, like, this was the first time I was actually finding out that my gap was caused by my tongue tie. And I was just like, but yeah, the gap was caused by the tongue tie. And then he said to me, the reason why all your teeth were fine except right here was because of the gap, which was caused by your tongue tie. So he said, really and truly, you really don't need to do much about it, but if you want to do something about it, you can cut the tongue tie and you can add braces to close the gap. And of course, it looks cute. I like it, but it was expensive. So, but I did want to close it. I know it looks cute and I like it, but at the same time, the little thing that used to come here, I didn't like it. So, and also, I wanted to try and see if I cut the tongue tie, what would it fix the way I pronounce certain words, right? So last December, I decided to go to my dentist and say, okay, check if you can fix it for me. He said I had to do the surgery. It was a minor surgery, it wasn't anything big. He just added anesthesia to just my mouth and, So he just basically cut that. I'll try to add a picture. I don't think the picture looked all that cute because I wasn't thinking of it. But I do have 2 pictures. He cut the tongue right at the tip here. Before it was this hair was attached down here. I'll try to find a picture. I'm not really sure if I do have one, but I'll try to find some pictures online to show you. So he basically just cut the front and the part here. Okay, I'll talk first, then I'll show you. So I basically cut the tip and the root of my mouth here at the front and in here. So here, and here. Alright, so I basically cut all of that and added stitches. And honestly, the first day I went home, I cried tears because I could not eat and I was not used to this. And I just cried because I bought something on my way home because of course I was going to do the surgery and my appointment I think was in the morning. So I just called my friend and was like, go to the dentist with me. And he was like, okay. He didn't even ask what I was going to do. I was like, okay. And I was like, cool. So I cut it and when I came home, I couldn't eat. And then I mistakenly just put my tongue back a bit and it pulled on the stitches. And my God, I was just like, I was so scared. And before I did the surgery, actually, I was like, what if I cut it and I can't talk any at all this time? Because I was fine before. I could like talk normal, just a little speech problem. And apart from that thing here, what if this time I actually cannot talk? That was my greatest fear. Even the night before going to they have dental hospitals. Before going to the dental hospital, I just had a panic attack and was like, should I really do this? But I had already paid my money, so I was just like, I'm gonna do this. So basically, yeah, that was my surgery. As I said, I'll try to add a few pictures if I can find any of before and after the surgery. And also, I got my braces. People normally say to me weird things about my braces, and I just don't know how I feel about it. I'll try to make another video because this video is going very long. So I'll try to make a video of my experience with my braces, where people ask me weird questions, and how I actually eat things I cannot eat with my braces, which gets annoying, like my bones, and like basically how I take care of my braces and all of that stuff. I'll put it in another video, which is probably part 2 of this video, but yeah, basically that. So yeah, just to summarize, I was born with the tongue tie. The tongue tie is basically the tip of your mouth attached to the roof of the tip of your tongue attached to the roof of your mouth. It should go away before you're born, but if you didn't, then you're born with a tongue tie, which is called Ankyloglossia. And yeah, basically that's it. You may need a surgery, you may not need a surgery. It is recommended that the surgery is done at birth, like, after you're born, before you grow older. And how to recognize it: speech problems, pronouncing certain letters, yeah, swallowing and all the stuff I did. So I can't really fully remember everything. But speech problem solving, kissing, blowing wind, like playing wind instruments and stuff like that. And as I said, with my experience with it, I never really fully recognized that I did have a problem until I came to China, and I had to speak Chinese and speak full English all the time and stuff like that. So as I said, if you did learn anything from this video, don't forget to comment it below and let me know what you learned. I'm about to end this video because it's getting too long. And yeah, if you have any other questions, please do ask me. You can also ask me on Instagram, Facebook, everywhere I have the same name, Avianewcreation, right? So as I said, I will do another video on my braces chronicles in the future. Right, so thank you for staying here, and thank you for watching this video. If you do like it, don't forget to give it a thumbs up, and do have yourself an awesome day.